Hi, we're going to be talking about Alzheimer's disease. Delving into some history on Alzheimer's, in 1906, Dr. Alois Alzheimer, a German physician, presented a case history before a medical meeting of a 51-year-old woman who suffered from a rare brain disorder. A brain autopsy identified the plaques and tangles that today characterize Alzheimer's disease. It wasn't until about 70 years passed before it was recognized as a common cause of dementia and a major cause of death. Only then did Alzheimer's disease become a significant focus of research. The research that followed has revealed a great deal, including the fact that Alzheimer's disease begins years before the symptoms of Alzheimer's dementia are present. Much is yet to be discovered about the precise biological changes of Alzheimer's disease that lead to the symptoms of Alzheimer's dementia, why the disease and its symptoms progress more quickly in some than in others, and how the disease can be prevented, slowed, or stopped. Now let's look more into what exactly Alzheimer's disease is. Alzheimer's is the type of dementia that causes problems with memory, thinking, and behavior. Symptoms usually develop slowly and get worse over time, becoming severe enough to interfere with the daily tasks. Alzheimer's is not a normal part of aging. The greatest known risk factor is increasing age, and a majority of people with Alzheimer's are 65 years and older. But Alzheimer's is not just a disease of old age. Approximately 200,000 Americans under the age of 65 have younger onset Alzheimer's disease, also known as early onset Alzheimer's. Alzheimer's worsens over time. Alzheimer's is a progressive disease where dementia symptoms gradually worsen over the number of years. In its early stages, memory loss is mild, but with late stage on Alzheimer's, individuals lose the ability to carry on conversation and respond to their environment. Alzheimer's is the sixth leading cause of death in the United States. Those with Alzheimer's live an average of 8 years after the symptoms become noticeable to others, but survival can range from 4 to 20 years, depending on the age and other health conditions. Alzheimer's has no current cure, but treatments for symptoms are available and research continues. Although current Alzheimer's treatments can't stop Alzheimer's from progressing, they can temporarily slow the worsening of dementia symptoms and improve quality of life for those with Alzheimer's and their caregivers. Today, there's a worldwide effort underway to find better ways to treat the disease, delay its onset, and prevent it from developing. With a prevalence, an estimated 5.4 Americans have Alzheimer's disease. By 2050, the number of people living with Alzheimer's disease in the United States is projected to be 13.5 million, fueled in a large part by the aging baby boom generation. Today, someone in the country develops Alzheimer's disease every 66 seconds. By 2050, one new case of Alzheimer's is expected to develop every 33 seconds, resulting in nearly 1 million new cases per year. In 2013, official death certificates recorded about 85,000 deaths from Alzheimer's disease, making it the sixth leading cause of death in the United States and the fifth leading cause of death in Americans 65 years and older. Between 2000 and 2013, deaths resulting from stroke, heart disease, and prostate cancer decreased 23%, 14%, and 11% respectively, whereas deaths from Alzheimer's disease increased by 71%. The actual number of deaths to which Alzheimer's disease contributes is likely much larger than the number of Alzheimer's disease recorded. The deaths of Alzheimer's disease recorded on death certificates. In 2016, an estimated 700,000 Americans aged 65 years and older died with Alzheimer's disease, and many of them died because of the complications caused by Alzheimer's disease. For the medical cost prevalence, in 2015, more than 15 million family members and other unpaid caregivers provided an estimated 18.1 billion hours to care for people with Alzheimer's and other dementias, a contribution valued at more than $221 billion. Average per person Medicare payments for services with beneficiaries aged 65 years and older with Alzheimer's disease and other dementias are more than 2.5 times as great as payments for all beneficiaries without these conditions, and Medicaid payments are 19 times as great. Total payments for 2016 for healthcare, long-term care, and hospice services with people aged 65 years and older with dementia are estimated to be $236 billion. The cost of Alzheimer's care may place a substantial financial burden on families, who often have to take money out of their retirement savings, cut back on buying food, and reduce their own trips to the doctor. In addition, many family members incorrectly believe that Medicare pays for nursing care and other types of long-term care. Such findings highlight that the needs to prevent dementia-related costs from jeopardizing the health and financial security of families of people with Alzheimer's and other dementias. For the epidemiology, a pooled data of population-based studies in Europe suggested the age standardized prevalence in people 65 years and older is 4.4% with Alzheimer's disease. In the U.S., people that are over 70 years old with Alzheimer's is 9.7%, Worldwide, the global prevalence of dementia is about 3.9% in people aged 60 and up, with the regional prevalence being 1.6% in Africa, 4% in China and Western Pacific regions, 4.5% in Latin America, 5.4% in Western Europe, and 6.4% in North America. More than 25 million people in the world are currently affected by dementia, most suffering from Alzheimer's disease, with around 5 million new cases occurring every year. The number of people with dementia is anticipated to double every 20 years. The age-specific prevalence of Alzheimer's disease almost doubles every 5 years after the age of 65, meaning 70, 75, 80, and so on. Among developed nations, approximately 1 in 10 older people 65 years and older are affected by some degree of dementia, whereas more than 1/3 of very old people 85 years and up may have a dementia-related symptoms and signs. There is a similar pattern of dementia subtypes around the world, with Alzheimer's disease the most common form of dementia, accounting for 50 to 70% of dementia cases. How Alzheimer's affects the exercise response. Patients with Alzheimer's disease have a more difficult time in focusing on activities that would require cognitive function, which unfortunately includes most kinds of activities. A patient who is running or doing some sort of cardiovascular exercise may either forget how long they have been exercising for, what their goals are, or forget how to perform the said exercise altogether. This issue can include mild problems such as forgetting what they're doing, where they are, and why they're exercising, causing confusion, anguish, or even depression. More severe issues can occur, such as forgetting how to breathe, swallow, or even forgetting how to physically perform exercise, which can cause more injuries. How exercise affects Alzheimer's. Although there is a lack of consensus regarding optimal physical activities associated with Alzheimer's disease prevention or improvement, aerobic activities and balanced training of moderate to severe intensities are considered optimal. Although exercise has a positive effect on cognitive performance, cardiovascular alone does not explain these benefits. However, the regular practice of walking improves cognition in Alzheimer's disease, while strength training is particularly more effective for improving postural motor function and reducing the risk of developing Alzheimer's disease, since it improves muscle mass and strength, shown to be affected in Alzheimer's disease patients. In addition, environmental conditions such as bright light exposure and good nutrition may play an important role in improving training results. Pharmaceutical indications for mild to moderate. Several prescription drugs are currently approved by the FDA to treat people who have been diagnosed with Alzheimer's disease. Treating the symptoms of Alzheimer's can provide people with comfort, dignity, and independence for a longer period of time, and can encourage and assist their caregivers as well. Most medicines work for people in the early to middle stages of Alzheimer's. For example, they can slow down some symptoms such as memory loss for a time. It is important to understand that none of these medications stop the disease itself. Medications called cholinesterase inhibitors are prescribed for mild to moderate Alzheimer's disease. These drugs may help reduce some symptoms and help control some behavioral symptoms. The medications are Razidine, Exelon, and Aricept. For the more moderate to severe versions of Alzheimer's dementia, a medication known as Namenda, an N-methyl D-aspartate antagonist, or an NMDA, is prescribed to treat moderate to severe Alzheimer's disease. This drug's main effect is to decrease symptoms, which could allow some people to maintain certain daily functions a little longer than they would without the medication. For example, Namenda may help a person in the later stages of the disease maintain his or her ability to use the bathroom independently for several more months, a benefit for both the person with Alzheimer's and caregivers. Namenda is believed to work by regulating glutamate, an important brain chemical. When produced in excessive amounts, glutamate may lead to brain cell death. Because NMDA antagonists work differently from the inhibitors, the two types of drugs can be prescribed in combination. The FDA has also approved Aricept, the Exelon patch, and Namzaric, a combination of Namenda and Aricept, for treatment of moderate to severe Alzheimer's disease. Some research. The number of Alzheimer's in Americans has increased from 5 million to 5.5 million or so in the last 10 years, but is expected to increase to almost 8 million by 2030, 11 million by 2040, and even increase to over 13 million by 2050. For the causes of dementia, Alzheimer's disease is overwhelmingly the biggest cause, responsible for about 2/3 of death, as shown by the pie chart. More research. There's 3 different stages of Alzheimer's disease. There's mild, moderate, and severe. For mild, it lasts 2 to 4 years. It's marked by minor memory loss. There's long-term memory and some reasoning remain intact also, so the patients may be aware of the decline and try to hide it well. For the moderate, it lasts 2 to 10 years. The patients experience a withdrawal, increasingly difficulty in self-care and daily tasks, poor judgment, and difficulty communicating. They also experience behavioral changes including anger, anxiety, frustration, restlessness, and finally the caregiver assistance becomes increasingly necessary. For the final stage, is severe. It usually only lasts 1 to 3 years. They're completely incapacitated to retreat into themselves and won't eat unless they're fed. Patients may not speak and do not recognize people, even family members. There's a loss of bodily function, such as swallowing, bladder, and bowel control. Also, violent episodes and aggression are common due to the confusion and fear of not knowing anyone or of lost control with their own body. So for my case study, I chose a 68-year-old female named Mrs. B. Mrs. B has been retired for about 8 years. She is considered to be quite active, raising 8 children while living on a farm. Her BMI is 25.6, her resting heart rate is 72 beats per minute, and she has a resting blood pressure of 122/78 milligrams of mercury. Her husband, 72 years old, noticed that she was forgetting about simple things like her keys, her wallet, and forgetting to turn off the stove and oven. He decided to take her to the doctors after he found out that she got lost only a mile away from home, which was concerning since she lived in the town for over 30 years. Mrs. B was put through a series of tests having to do with her cognitive levels and memory skills, and had scores low enough to put her through a series of more tests. She was then diagnosed with mild Alzheimer's dementia by her doctor and prescribed a daily dosage of an inhibitor Exelon to help improve her cognitive function and slow down some symptoms related to Alzheimer's disease. Some suggestions that I had to help slow down Mrs. MB's condition, or at least soften the progress, are music therapy is one. It's been proven that music stimulates the brain, especially when music that a patient has grown up with. It will open even just a little bit parts of the brain that wouldn't if it weren't exposed to music. Daily physical activity would also help improve the patient's well-being and keep at least her body in shape. A daily dose of walking can help improve their cognitive function and get more blood flow to the brain to help them think a little better and clearer. Daily social interaction as well as memory improvement games help, including flashcards that which can have a positive impact on the patient. It will also help the caregiver see where the patient is with their condition and adjust the levels and difficulty of social interaction accordingly. One of the biggest things that you always should be is supportive and caring. It is always good to be patient and understand that the conversation may go nowhere, but it's being with the loved ones that matter. They will always love having company, no matter who it is. For my exercise prescription for a person with Alzheimer's, a daily dose of walking and low-impact exercise is best for a person with some form of Alzheimer's. Whatever the level of exercise was in the past, keep with it until it is deemed necessary to decrease the intensity and duration of physical activity due to having moderate or worse forms of Alzheimer's. The last thing to go in patients with Alzheimer's disease is their body, so it is possible that they can perform normal physical activity like they always have until they are diagnosed with moderate or severe Alzheimer's disease. And here are all my references. Thank you for listening, and I hope you learn more about Alzheimer's disease.